Hi. Good day. How are you? That's good. My name is Dr. Andrew Michaels, and today I'll be giving you an eye exam. Will that be okay? All right. Thank you very much. Now, it says here in your records that you're having a problem with pupil dilation. All right. So, what we want to do here is do a rudimentary eye exam. And first thing we want to do here is, can you tell me what is the furthest down on this chart right here that you can read? Okay, comfortably. All right, can you go ahead and read that line for me? Very good. Thank you. Can you read anything from this line further down? No? And can you start here and read as many lines as you can? Okay. All right. Very good. Very good. Now the next part, we want to check your eyes for more up close. So I'm going to hand you this piece of paper. I'm going to reposition my chair now and turn this off. Position here. Get you in closer so we can do a little bit better examination on your eyes. Just let me look here real quick. Just want to kind of look over your eyes. Can you push down up on your... Yeah, just let me push up on your eyelids. Just a little bit. Then I want to push down on your eyelids. Push down. Yeah, just like that. Okay. Very nice, very nice. And I need you to focus on my finger. All right, keep your eyes pointing at my nose. And I want you to follow my finger with your eyes only. Yep, just like that. And the same thing over this way. Yep, very good. Okay, that's pretty good. Up. And down. All right, very good. I think I feel pretty comfortable with everything so far. I think the main issue here is your pupil dilation. And I'm going to check your eyes real quick. So I just want to use this magnifying glass. I want to see in there. Oh yeah, I see that. There is a problem there. We need a tissue. See if I can find one. I don't have one handy. See if I can use... You do have an eyelash on your eye. I can see it right there. See if I can get that eyelash out of your eye. Oh, I got it. Hold still. There it is. I don't know if you can see it. Even against the black background. But I got it. Good thing we checked with this magnifying glass. Let me see if there's any other debris we need to worry about. Okay. No, I think you're in really good shape. I would like to clean your eye, but we're going to wait on that. Let me check something here real quick. This one. Oh yeah. Yeah, that definitely needs cleaned. So what we're going to do is we're going to take this tiny little sterile cotton swab. We're just going to clean that area just a little bit. I wish I really had a... There we go. Okay. Let's get in there. Let's clean the area up a little bit. There, that looks a lot better. I feel a lot better about that now. It's hard to give a really proper diagnosis if you have any impediments in the eye to begin with. So now that we've got that done, let's just take a quick look here. Let's just take a quick look. Oh, yes. Oh, yeah. Okay, what I want you to do is stay focused. Just keep your eyes right here on my nose. And I'm going to block off one half of your eye. A little bit like that. Yes. Oh, yeah. Oh, yeah. Oh, yeah. Mm-hmm. Still. Okay. No, it's okay. This is not a big deal. I'm blocking off this side now. Just a little bit. Holding the paper up over your eye. And then we can check proper dilation. The whole idea here is to check for proper dilation. Oh, yeah. Hold still. Uh-huh. Okay. Very good. I need you to do just a couple little things here. Rule out a couple minor illnesses. Could you just stick your tongue out? Okay. All right. Oh, yeah. Mm-hmm. Yeah. Oh, yeah. Look at the top of your mouth. Oh, yeah. Very good. And I just want to feel your glands and check your neck real quick. It'll just take a second, so just hold still as best you can. Just hold still. Okay. Just checking your glands. Checking the glands. Just making sure that we got all the bases covered. Making sure we know exactly what we're dealing with here. All right. Just right about. Oh. There we go. Yeah, you don't have to stoop over like that. Is that more comfortable? There you go. Very good. Very good. That's more comfortable. Okay, I just need you to sit as comfortably as possible. This next part is going to be a little bit. Might feel a little uncomfortable. We're going to do a pressure check on your eye. Okay, so what we do is we have this very soft tip and we put it up against your eye and we just puff a little bit of air in there. First we do the left eye. There you go. That didn't hurt at all, did it? Yeah, it does blur a little bit because it's so close to your eye. And then we're going to do the other eye now. So get ready. Get ready. Just like that. Yeah. You responded quite well. We got a good reading on that. So I think you're just fine. Okay, now, what we want to do now is I have a brighter pen light. Here is my normal pen light, This one is slightly brighter. See the difference? Now, and what we're going to do now is I'm going to check for proper dilation. And if we achieve proper dilation, we'll know pretty quickly. And if we don't, we'll kind of zero in on what the problem is with the dilation of your eyes. The second part that's very important is we want to check for maximum dilation. Maximum dilation. It's very important. So you have proper dilation, maximum dilation. And that's knowing that the eye can reach its maximum. So we're going to check for both, okay? All right, so keeping your focus on me right here. Keep your eyes narrowly focused. Okay, just like that. Checking for proper dilation. Okay. Checking for proper dilation. Zeroing in on that. Oh, there it is. Yeah. Okay, that time I saw it. Okay, let's try one more time. We'll go through the whole steps again here. Proper dilation. There it is. All right. Very good. Very good. Very good. Oh, there it is. Very good. Very good. Now, dilation is the eye opening up and turning blacker so that you can get more light. That's why we do it in this darker room. What we're doing in this case is in reverse. We're making it shrink, and then we're seeing it expand to maximum dilation. So, shrinking it in with the pen light, right? Shrinking it in, watching it shrink, watching it get smaller. Then we remove the light and we get expansion and maximum dilation. It's very important. We must have maximum dilation. Yes. Very good. Glad you agree. So now we're going to check on this side. So I want to come in. I kind of know. There we go. Very good. Very good. Keep looking right here. Keep looking right here. There it is. Very good. Up there it is. That's really good. And once more. Once more. Very good. You don't mind? Do you mind if I do it one more check? Just to make sure? Alright, let's check one more. One more time. Nice and slow. There it is. Perfect. Maximum dilation. Very good. There we go. Very good. Very good. Yep. There we are. Fantastic. And I just want to check both eyes now. Now, the way I want to do it this time is I want to check both at the same time. So I'm going to come in from the top and the bottom. So, from the bottom. Very good. Very good. Keep looking at my nose. Keep looking. wonderful. Okay, now I think we're going to look from the top down. So, hold still. Hold very still. There it is. You can feel it? Good. Very good. Does seem a little blurry. Once more. All right. We are definitely, they're both working in concert together. And I really feel comfortable that we're getting proper dilation. And what I'm worried about right now is that spot I tried to clean earlier. It just, is that better? I just gotta get in there and get it. I'm really worried about that spot. I don't know if I'm 100% comfortable. Well, I don't think that it was just a little hair or fiber. I don't think it damaged the eye. It wasn't an eyelash like digging in, but it definitely did something to the eye. I have this softer tip here. I'd like to try something. Don't mind. I think we'll use a lower light. Too strong a light. Too strong. Now, looking right at me, look down at my chin. So right about here. Just want to see if we can clean that off a little bit better. Let's get that, clean that off a little bit. Just hold still. Hold still. Keep looking down at my chin. Keep looking. Keep looking. Very good. The outside rim. Keep looking. Looks a lot better. That looks a lot better. I feel a lot more comfortable with that. Let me just check in real quick here. Oh yeah, that looks better. That looks a lot better. Do you feel better? If you don't mind, I'd like to, go ahead. You have a concern? Go ahead, tell me. Yes. Yeah. That's definitely a concern. I'm glad you brought that up. You know, it's your health, it's your body, and it's your eyes. If you have any kind of questions, you should always ask your doctor. And if your glasses aren't comfortable, or if they don't fit properly, or they just don't feel right. Okay, these are the glasses that we prescribed, and at the time of the check, they were the right ones. But something has changed. Something in your physiology, the makeup of your body changed. And they're not, between the time we tested and the time you're wearing them, maybe the lab made a mistake. You know, labs do make mistakes. Maybe they made a mistake on the prescription. And you won't know that unless you question it. You put them on and they are not correct. And if they're not correct, they're not right. They're certainly not right for you. And you know, it's never happened in my entire practice in eye care. It's never happened that they gave the wrong glasses to the wrong patient. It's never happened. We are a very, very careful double check, triple check. We also do have many safety protocols in place to prevent these kind of situations. But you never say never in the medical field. The minute you say that can't be the answer or that can't happen, human experience and the history of human experience tells me that the impossible is possible whenever human involvement takes place. So, there could be an error in somebody had a bad day, the lab mixed up the numbers. If you think your glasses are not correct for you, please question it. Please make sure your health care provider does his utmost to double check the prescription and does a physical check to make sure that they're correct. Because I know at least 2 different people who, for some reason, there was everything checked out, but it was a mistake at the lab. We run your lens underneath this machine, and it checks the prescription. We can physically check that prescription on this machine. Right here, just like this. And it's happened to me twice where the prescription was wrong. The lab technician reversed letters, reversed numbers, something went wrong. Somehow he picked up the wrong lens. I don't know. Regardless of the situation, it's your eyes. And your healthy eyes are my number one concern. And I must stress to you that you must pursue this. I have had many eye problems myself in the past, and having proper prescription eyeglasses is such a blessing, but it's also a curse. They have to fit right. They have to fit my face. So there's an aesthetic to them. There is a fashion part to the whole process. There is, of course, the optical part. Yeah, you can have transition lenses. Who told you couldn't have? You can have transition lenses. You can have anything you want. It's just an addition to your glasses. Well, this dilation problem, it really won't interfere with transition or sunglasses. No. The idea of the sunglasses is to filter out UV and infrared and ultraviolet radiation from the eye to help the eye deal with it. So if you have a dilation problem, actually wearing sunglasses is probably the right thing for you. Might be the right thing. And there's no might about it. It probably is the right thing. Now that we've done this a little bit, it does seem like the eyes are dilating better now that we've done it a few times. It does feel better, doesn't it? We're definitely getting proper dilation now. And you should see it when I pull it away. I can see the maximum dilation. Proper dilation, maximum dilation each and every time. I'm very, very happy for you. Very happy, very happy. It's very good, very good. And I also see that there's a little bit of redness right here where we pulled that out of the eye and then we cleaned it here and on top. There's a little streak of red in your eye, and that should clear up. I can get you some drops to deal with that if you'd like. You feel it doesn't? Is it bothering you at all? Irritating you at all? No. Okay. So, I think what we have here now, if I may just write down a few notes on you. I think your prescription is fine. And I think you may have a little bit of depression from seasonal affective disorder. Have you ever heard of it? Seasonal affective disorder. That's where you start getting less and less vitamin D due to the low sun in the horizon, and you naturally get a little more depressed. And I think if we can get you some vitamin D, not too much, just one little supplement, just add it to your daily regimen. I think it's 1,000 milligrams will probably be good enough. And then the other thing is to try to get out and get a little more sun. Go for a walk. Try to go and check your mail during the day. Things that you might wait till evening after 5 when it's dark in the winter. Try to move those things up, like when you first get home from work. Take the trash down to the curb, check the mail, get your newspaper, take the dog outside for a walk. Do all those things while there's still a little bit of sunshine in the sky. And you naturally get vitamin D from the sun. And that's a big plus. That's a big plus. You really don't need much in the way of supplement. You know, milk has a lot of vitamin D in it. So just pick up a little bit on your dairy. Take a supplement and try to, like I said, do some of your outside chores. I need to get gas. Go get gas during the day, out in the sun. If it is a sunny day, try to maybe go out for a short lunch break walk and absorb some of that afternoon, sun, the high noon sun. It's not much, but it does help. And how this affects the eyes is, I think you go from really bright lights to very dim outside, and then you've got the bright headlights hitting you. And I think your eyes are just having a really hard time adjusting to it. You also have, usually this time of year, a much dirtier windshield. So we want to make sure the windshield is clean. Keep plenty of washer fluid in your car. Keep your glasses clean. All these things can attribute a little bit to, dust particles, and smears on your glasses can also affect the refraction of light. And when you get those strong headlights coming through your windscreen, I think that's the blur you're seeing. Because when you came in here, your glasses had some pretty good smears on them. And I think it's a little harder when you have such dim light to work with. I really think that's part of the problem. Do you feel more comfortable now that we've had the exam and we've checked everything out? Yes, I think your eyes have proper dilation, and they certainly are going to maximum dilation with the light and then taking it away. So I feel very comfortable with saying that your eyes are in very good shape. Well, that's good. And, I am so glad I have the itchy nose today. Allergies are terrible this time of year, aren't they? We are filtering the air so much because of the pandemic. I think that we're not exposing ourselves to all the normal allergens that we normally get, and then we get a dose of them and it seems worse. But I love it. I've been so isolated because of COVID-19 and being so much more careful. Sinuses have not been plugged all winter. Lots of breathing difficulties have been in the past. So as long as I can stay healthy just a little longer until I get my vaccine, I'll be fine. Are you getting the vaccine? Good. Good. I'm glad. Yes, when I get it, I'm hoping to either photograph myself getting it or film myself getting it, but I don't want to take up the caregiver's time setting up a camera, but I'm going to try to do that, just to prove, not just to prove I did it, but to help promote the idea of getting it, to put an end to this whole silly pandemic that we're dealing with. I know it's really getting tiresome, and I'll be glad when we can move on from this, get things somewhat back to normal. Well, it was good meeting you today, too. Just a little fist pump. There we go. Yeah. Okay. Well, let yourself out and see our receptionist on the way out about your contacts and the cleaning solution that you need. And we have a free cleaning kit for you for choosing us today. So we're going to get that to you to help you keep your glasses a lot cleaner. I think that'll help you a lot. Well, proper dilation is very important, and I'm glad you took the time to come in here and check it. It is important. And I don't ever want you to not go to the doctor because you think it's frivolous or not important. If you think it's important, then it is important. It's important that I take the time to listen to you and answer your questions. Okay? All right. Well, until I see you again, please have a most blessed day. Okay? All right. Bye-bye. Okay, that was really nice. That went very well. And I'll put that in their chart. And it's lunchtime. There we go. Time to take a break. What's that? Well, that's weird. Let's get that checked. Gotta go to the dermatologist. Great. Interesting.